Welcome. So, we're going to talk about something that can totally change your nursing practice, the sleep assessment. But let's be real, we're not just going to go through a checklist. We're going to turn this whole process into a fascinating investigation. The goal here is to give you a brand new framework to help you become a true sleep detective for your patients and start uncovering the stories that their sleep, or lack of it, is trying to tell you.
All right, so every good investigation needs a plan. Here's ours. We'll start with the mission, then we'll dive into the routine, follow some clues, look for accomplices, interview a key witness, and finally, we'll put together your very own sleep detective toolkit.
So first things first, let's talk about the why. Why is this a mission? Well, because sleep isn't just about resting. It's this incredibly active period of restoration that honestly impacts every single system in the body. I want you to really think about this for a second. We are so good at tracking temperature, pulse, respirations, blood pressure. But what if sleep is just as vital? What if a bad night's sleep is a huge warning sign, just like a fever? This single question is really the whole foundation for our investigation. It changes how we approach every single patient.
Okay, let's get down to business. Time for our first line of inquiry. You know, every great detective starts by examining the scene of the crime, right? To get a baseline. For us, that scene is the patient's bedtime routine.
This is where we start building our profile. These questions are your best tools. Asking, what do you do in the hour before bed, is so important. You might uncover a huge clue, like maybe they're scrolling on their phone, and all that blue light is just killing their melatonin production. Or asking if the room is dark and quiet. That's like dusting for fingerprints at the crime scene. Every little detail helps you piece together what's really going on every night.
You know, a messy crime leaves everything everywhere, and a bad night's sleep is exactly the same. Our investigation absolutely does not stop when the sun comes up. The consequences of poor sleep leave a trail of clues all over your patient's day.
Now this might be one of the most powerful questions you can ask. I know it sounds almost too simple, but the answer is your key to understanding the real-world impact. A yes to this question is like a big flashing red light telling you that their poor sleep isn't just a nighttime problem. It's actively messing with their quality of life.
And here you go. This is basically your detective's cheat sheet for those daytime clues. Think of it like a field guide. On one side, you've got your refreshed and restored patient. They're alert, they're focused. But on the other side, you've got the fatigued and foggy patient. And you need to listen for their testimony, you know? When they use words like irritable or I just can't focus, those aren't just complaints. That's hard evidence of cognitive decline.
Okay, now we get to the really juicy part. You see, a lot of the time, poor sleep isn't a solo act. It's got accomplices, other medical conditions that are secretly, sabotaging their rest. And our job is to unmask them.
Suspect number one is chronic pain. It's a notorious sleep thief. Now, as a nurse detective, you have to be precise with your questions. You're not just asking, do you have pain? No, you're directly linking their known diagnosis, in this case, osteoarthritis, to their sleep problem. This is such a great communication trick because you're actually helping the patient connect the dots for themselves, and a lot of times they haven't made that connection.
All right, next up on our list of accomplices, metabolic issues. Diabetes is a huge one, and the question that really opens this door is, how well is your diabetes controlled? This lets you dig deeper and connect their blood sugar management directly to why they might be waking up all night long.
And that question naturally leads us to a key piece of jargon, polyuria. Now, this isn't just being a lot. This is a specific medical sign. And when you see it in a patient with diabetes, it's a massive clue that something's going haywire metabolically while they're trying to sleep.
And here's the why, the actual mechanism behind the crime. And here's a great way to remember it for your exams and for practice. Just think of high blood sugar making the blood thick and syrupy. The kidneys go into overdrive trying to filter out all that extra sugar. But here's the trick. Glucose acts like a little magnet for water. It pulls water with it. This process is called osmotic diuresis, and it's basically the body's desperate attempt to flush out sugar, which leads to tons of urine. So the patient isn't just waking up, their own physiology is forcing them awake.
Okay, so we've talked about accomplices like pain and diabetes. Those create internal clues the patient can feel. But some of the biggest issues create external clues that the patient is totally unaware of because, well, they're asleep. Our patient is the victim here, but they're unconscious during the main event. So just like any good detective, we have to find a witness.
This phrasing is just brilliant. It's a perfect example of effective communication. Instead of asking, "Do you snore?" which, how would they know for sure, you frame it as, "Does your husband tell you you snore?" This immediately shifts the focus to a witness. It's not accusatory, it takes the pressure off the patient, and you're way more likely to get an accurate report.
So the witness says, yes, they're snoring. Now, what does that clue actually tell us? It's way more than just a noise. That's the sound of the airway vibrating. It's a sign of a potential obstruction. And it is a major, major red flag for obstructive sleep apnea, or OSA. And you always have to ask a follow-up. Ask the witness if they ever hear gasping or choking. If you get that piece of evidence, your next move is critical. You document it clearly, you report it to the provider, because this patient may very well need a formal sleep study.
So we've done the work. We've gathered evidence from the routine, the daytime clues, those medical accomplices, and our night witness. Now it's time to pull it all together and build our sleep detective toolkit.
And here it is, your 5-step sleep investigation. Seriously, think of this as your new go-to protocol. It's simple, it's memorable, and it makes sure you never miss a critical clue. 1. Profile the routine. 2. Check the daytime. 3. Uncover accomplices. 4. Interview the witness. And 5. Synthesize all those clues to see the complete story.
So if you only take one thing away from this, let it be this. Your investigation is not just about the 8 hours they're supposed to be asleep. It is a 24-hour case. The clues you find during the day help explain the night, and what happens at night absolutely explains the day. Your job, as the detective, is to connect all those dots. So I'm going to leave you with this question. The next time you walk onto your unit for a clinical shift, I want you to remember your new role as a sleep detective. Listen really closely. Ask these targeted questions. And honestly, be ready to be surprised by what you find. What hidden clue is just waiting to be discovered in your next patient's sleep story? And more importantly, what are you going to do with that clue to make their care better?